Okay, picture this. It's Sunday afternoon, you've just polished off a seriously indulgent meal, maybe something creamy and rich, and then wham! This wave of intense, cramping pain grips you right under your ribs.
Yeah?
It comes and goes, but when it hits, it's just all-consuming. Sound familiar, or maybe just the kind of discomfort that makes you wince?
Uh-huh.
Well, that's the territory we're venturing into in this deep dive.
Exactly. Today, our focus is sharp, biliary colic. And we're really diving into the revision notes you shared with us.
Right.
We want to pull out the crucial information you need to really understand this, well, surprisingly common cause of abdominal agony.
Think of this as your streamlined guide, getting to the essentials.
Yeah, mastering the basics.
Our mission, to make biliary colic crystal clear, easy to remember, and maybe even, dare I say, interesting.
Let's hope so.
We're sidestepping the really dense medical jargon and just zeroing in on what's most important for you to know.
What it is, what triggers it.
Exactly. Who's at higher risk and sort of what's the game plan for dealing with it. Get ready for those light bulb moments.
And you mentioned memory aids.
Oh yeah, we'll definitely be looking at a clever little trick later. Involves 4 Fs to help you remember the key risk factors.
Ah, okay. Sounds useful. So let's get straight to it then. What exactly is biliary colic?
Right. In simple terms, biliary colic is abdominal pain, but it's a specific type. It happens because the tubes that carry bile, your bile ducts, get temporarily blocked or go into spasm.
And the usual suspect, as your notes point out, is gallstones.
Definitely, those small, hard deposits that can form in your gallbladder. But, it's worth noting that occasionally other issues can cause similar pain.
Okay. And what about the pain itself? What's it like?
It's not just a dull ache, apparently. It's typically described as recurrent and really quite severe.
Right.
You'll often feel it in the right upper part of your abdomen, so under your ribs on the right side, or maybe in the epigastric region, which is that upper middle part of your tummy.
And severe means? Well, how long does it usually last?
The notes say it can stick around for anywhere from 30 minutes up to several hours. Imagine that.
Wow, that's a long time for intense pain.
A persistent, sharp pain that just won't quit. And something that really struck me is that it can radiate,
Radiate where?
to your back. Pain starting in your front and kind of shooting through sounds pretty unpleasant.
Yeah, definitely. And a key trigger to remember.
Ah, yes. It often flares up after you've enjoyed a meal that was high in fat.
That connection to fatty meals is such a vital clue, isn't it?
Totally.
And your notes also mention obstructive jaundice as a potential red flag.
Explain that a bit more.
Well, if the blockage is bad enough that it stops bile flowing properly, it can lead to a yellow tinge in the skin and the whites of the eyes.
Ah, okay. So that's a sign the blockage is pretty significant and needs proper attention.
Exactly.
Definitely something to watch out for. And thinking about who gets this, the notes highlight some patterns, right?
Mm-hmm. It tends to affect women more often, but frequently those in their 40s.
Right, the 40s.
And there's also an observed link with obesity and, interestingly, a fair complexion.
Okay, so now let's dig into the why. What's the primary cause? The etiology.
So etiology just means the cause, right?
Yep, exactly.
Mm.
And the notes are pretty clear on this. The main culprit is those pesky gallstones we mentioned.
Right.
These stones can get stuck in the bile ducts, and this blockage is what sets off the pain and inflammation.
Like a traffic jam in your body's plumbing system.
That's a good way to put it, a kink in the hose.
And while gallstones are the main event, it's good to remember those other factors too.
Like what?
Well, the notes briefly mention functional disorders of the gallbladder. So the gallbladder might not squeeze and empty bile as effectively as it should.
I see.
And there's also something called biliary dyskinesia, which is kind of a similar issue with the movement of bile. Less common, but they can also cause that typical pain.
Okay, so who's most likely to find themselves dealing with this biliary traffic jam? Let's talk risk factors.
Okay, and this is where that handy mnemonic comes in, right?
The 4 Fs.
Exactly. Your notes list several risk factors, but some key ones are summed up nicely by fat, female, fertile, and 40.
Okay, let's break that down. Fat is referring to obesity, which we mentioned.
Mm-hmm.
Female highlights that women are at higher risk, probably due to hormones.
Hormonal factors, yeah.
Fertile suggests pregnancy can increase the likelihood.
That's right.
And 40 reminds us it's more common as people age, often showing up around 40 and onwards.
Precisely. A very memorable tool. And beyond the 4 Fs, the notes also list other important ones.
Such as?
Simply increasing age in general, a diet High in fat, which makes sense given the link to symptoms after fatty meals.
Right.
Rapid weight loss, interestingly. Also a family history of gallstones, diabetes, and even Crohn's disease.
So quite a few things can up someone's chances of developing gallstones and potentially biliary colic.
Yeah, it's a combination of factors often.
All right, so we know what it is, who's at risk. But what's actually happening inside the body to cause that intense pain? Let's get into the pathophysiology.
Okay, so what's a basic mechanism?
Well, at its core, the pain of biliary colic is a direct result of that blockage we keep talking about.
Right.
As your notes explain, when a gallstone gets lodged in a bile duct, it creates a backup. Bile can't flow freely.
And this blockage causes a big increase in pressure
Right.
inside the gallbladder and the whole biliary system.
Exactly. And that increased pressure sets off a chain reaction. The gallbladder starts to stretch. It gets distended and inflamed.
Oh, okay.
And it's that stretching of the gallbladder wall that's the main source of the characteristic colicky pain.
That gripping wave-like sensation.
Yeah, that comes and goes.
And the slightly good news, perhaps, is that the pain typically goes away once the obstruction clears.
How does that happen?
Either the gallstone shifts and stops blocking the duct, or maybe it manages to pass completely through the system.
Okay. Now, because this pain can be so intense and it's in the upper abdomen, it's really important to think about other possibilities, isn't it?
Absolutely. Differential diagnosis is crucial.
So what else could mimic biliary colic?
The notes list several conditions with similar symptoms. The most closely related one is acute cholecystitis.
Which is?
That's full-blown inflammation of the gallbladder itself, often because a gallstone gets properly stuck. It's usually more persistent than colic.
Okay, more serious then. What else?
Then there's choledocholithiasis. That's when gallstones have actually moved out of the gallbladder and into the main pipe, the common bile duct.
Ah, okay. And it's not just gallbladder issues, is it?
No, definitely not. The list also includes GERD, gastroesophageal reflux disease. That can cause upper abdominal pain too.
Acid reflux, right?
Yeah. Peptic ulcer disease with its stomach pain is another one to consider. And pancreatitis, inflammation of the pancreas, can also cause severe abdominal pain.
So lots of possibilities.
Which is why getting the right diagnosis is key, because the treatments are all quite different.
Makes sense. So how common is this? Let's touch on the epidemiology in the UK. What do the notes say?
They state clearly that biliary colic is a common condition here.
How common are we talking?
The estimated prevalence is between 10 and 20% of the UK population.
Wow, 10 to 20%. That's actually quite a lot of people potentially affected.
It really is. A significant number might experience this at some point.
So if someone is having biliary colic, what are the typical ways it shows up? Let's revisit the clinical presentation. What would a patient usually describe?
Well, the key feature, as we've said, is that severe episodic pain, usually in the right upper abdomen, the RUQ.
Right.
And the notes reiterate it typically lasts from about 30 minutes up to several hours per episode.
And it doesn't always stay put, right? The radiation aspect.
Exactly. The pain can radiate or spread to other areas, commonly the back, the right shoulder, or even between the shoulder blades.
That pattern of pain must be a really helpful clue for doctors.
It absolutely is. And the notes also highlight nausea and vomiting are very common alongside the pain.
Right? Feeling sick.
Yeah. Plus, that telltale sign of intolerance to fatty foods, discomfort, or worse pain after eating greasy meals is a really strong indicator.
The notes have a great summary of these features, almost like a checklist.
Yeah.
Colicky pain, RUQ, worse after eating fatty foods, maybe radiating to the right shoulder or between the blades, often with nausea and vomiting.
And importantly,
Yes, importantly, to help tell it apart from other things, there's usually no fever and normal liver function tests and inflammatory markers and simple, uncomplicated biliary colic.
that absence of fever and those normal blood results are really key for distinguishing it from, say, acute cholecystitis.
Where you would expect those markers to be off.
Exactly, because the gallbladder is actively inflamed then.
Okay, so someone comes in with these symptoms. What investigations are typically ordered to confirm it's biliary colic?
Right, the diagnostic steps. The primary investigation for actually seeing the gallstones is an abdominal ultrasound.
Just like the ones used in pregnancy.
Similar technology, yeah.
Yeah.
It's non-invasive and usually gives a clear view of the gallbladder and any stones inside.
And what about blood tests? What are they looking for?
Blood tests mainly assess liver function. As
Yeah.
we said, they're usually normal and uncomplicated biliary colic, but they help rule out other causes of abdominal pain, especially things affecting the liver or bile ducts more directly.
Okay, the notes also mention MRCP and ERCP, bit of alphabet soup there.
Ah, yes. MRCP is magnetic resonance cholangiopancreatography.
Okay.
It's a special type of MRI scan giving detailed pictures of the bile ducts and pancreatic ducts.
And ERCP.
That's endoscopic retrograde cholangiopancreatography. It's more involved. A thin tube with a camera goes down, and dye is injected to see the ducts on X-rays.
When would they use those?
They might be considered if there's a suspicion that stones have moved into the common bile duct, or there are other more complex issues going on in the biliary tree that the ultrasound didn't clarify.
Got it. So let's say the diagnosis is confirmed. How is biliary colic typically managed?
Well, the initial focus is on relieving the symptoms when an attack happens.
So pain relief.
Exactly. The notes highlight using NSAIDs, non-steroidal anti-inflammatory drugs, as a key way to manage that acute pain.
And besides popping pills, lifestyle changes are important too.
Definitely. The notes strongly recommend dietary changes.
Which means
Avoiding those high-fat foods that we know can trigger episodes. That's a crucial step in trying to prevent more pain.
and what if it keeps happening or it's really severe?
Then surgery might be on the cards. That's where cholecystectomy comes in.
Which is removing the gallbladder.
That's right. The notes mention that elective laparoscopic cholecystectomy keyhole surgery is usually the preferred option.
Less invasive.
Yeah. And interestingly, they also add a statistic. In about 15% of patients having their gallbladder out, stones are actually found in the common bile duct during or after the op.
And that matters because
As we discussed, those stones can cause obstructive jaundice or other problems and might need further treatment, maybe an ERCP.
Right, makes sense. So looking ahead, what's the typical course? What's the prognosis for someone with biliary colic?
Well, the notes indicate that individual episodes, the attacks of pain, usually resolve on their own within a few hours.
Okay, that's something.
And this is a big, but if the underlying cause, usually the gallstones, isn't dealt with through definitive treatment like surgery,
Yeah.
recurrence is very common. The pain is likely to come back.
And there are risks if it's just left untreated.
Absolutely. The notes caution there's a real risk of complications.
Okay, so let's talk about those potential complications.
Right.
What can go wrong if biliary colic isn't managed effectively?
The notes list several potential issues. One big one is progression to acute cholecystitis.
The persistent inflammation we mentioned?
Exactly. Potentially with infection. Another is cholelithiasis, stones getting stuck in the common bile duct.
Leading to jaundice.
Jaundice, or even cholangitis, which is a serious infection of the bile ducts themselves.
And are there other serious gallstone-related problems?
Yes, definitely. Biliary pancreatitis is another major one. That's where a gallstone blocks the opening, where the pancreatic duct joins the bile duct, causing inflammation of the pancreas. Very serious. And of course, as we just mentioned regarding prognosis, the recurrent episodes of biliary colic themselves, even without these major complications, can really impact someone's quality of life because the pain is so unpredictable and severe.
Right. So just to wrap this up then, we've really covered a lot of ground on biliary colic today, all based on those excellent revision notes you provided. The key things for you, the listener, to remember are it's abdominal pain from a temporary bile duct blockage, usually gallstones.
Leading to that recurrent severe pain, especially after fatty foods.
Don't forget those 4 Fs for risk factors, fat, female, fertile, 40.
Embonic.
And while single episodes often pass, the high chance of it coming back and the risk of serious complications mean getting a proper diagnosis and management plan is really important.
And that brings up a really crucial point for you listening.
Yeah.
If you, or maybe someone you know, experiences this kind of recurrent, intense abdominal pain, understanding what might be going on, like biliary colic, is that first step towards getting the right medical advice and care.
Absolutely crucial. And if you're keen to explore this topic further, or maybe you need more resources for your own revision, definitely check out MSRA.com.
And freemsra.com as well. Both are fantastic platforms packed with valuable information to support your studies.
They really are great resources.
We genuinely hope this deep dive has given you a much clearer and hopefully memorable understanding of biliary colic.
Yeah, hopefully demystified it a bit. Until our next exploration, keep digging deeper and keep learning.